Good afternoon, everybody. Welcome to Senior Marketing Specialist University presents What's the Deal? I mean, all this, I can't actually remember the full title of this, but long story short, it is it's the slash. A case for Medicare supplements. Again, talking about a case for Medicare supplements. Why is this webinar going on? First of all, welcome. Your name. Let's try this again, guys. My name is Olivia Richardson. I am our Vice President of Corporate Alliances here at Senior Marketing Specialist. I have built my career off of training and education and building agents up both in agency training, sales training, industry training. That is where I have found my passion, where I've built my entire career on. And my goodness, have I been busy lately. The industry just keeps on providing disruption and providing opportunities for us to make an opportunity out of the industry. Good morning, Sherry. She says, is it hot enough for you? Blame it on the heat. Anything that goes wrong right now, Sherry, I'm saying it's just so hot. Right? Like my taxes are out of control. It's so hot. For those of you who want to be like Sherry, you want to interact with today's presentation, you have two options to do so. Number one, this is my phone number. That is my actual phone number. You can text me at any time. You can text me during the show, or if you're watching the recorded version of this, you can text me that way. That is equally as fine. Or if you have a Gmail account or a YouTube account, you do have the opportunity to live chat as well, and I will answer your questions as they come up and just have some conversation. But what we're talking about today is something that we're seeing kind of the results of what the industry has really been doing with Medicare supplements, starting back, not to be dramatic, but like back in 2010 when Medicare supplements became standardized. We saw the removal of Plan J. We saw the primary plans be F for the longest time, then incorporating G and N. And honestly, I'm not going to say the demise because that is a little dramatic. But when we see like what is happening right now in the Medicare supplement world, we can date a lot of what's going on now to back whenever Medicare supplements became standardized. And a huge reason for that, let's get into it, right? Let's see. So what's happening in the Medicare supplement world? Why are we talking about Medicare supplements? It's so funny because back in 2000, I first got started in the industry in 2013. I spent a good chunk of my career talking about why Medicare supplements weren't the only product on the ship, right? I was trying to convince agents to start looking at and representing Medicare Advantage, and many didn't want to do that because all anybody wanted to sell was Medicare supplements. Medicare Advantage plans weren't proven yet. Now I'm seeing a lot of agents coming up and saying, why do I even want to look at Medicare supplements? What's going on with Medicare supplements? And ultimately, what we're seeing is a disruption in the market and instability in the market. Ultimately, that's what's going on. And the instability in the market, how are we able to see that right now? First of all, what everybody's talking about, your clients and everything, these massive rate increases. A year ago, we were talking about, 15%, 17%. Now, it's not uncommon to see a 40% increase in some states on your Medicare supplement premiums. That's substantial. We've not seen that in the industry until this year. So that's a huge indication that the market isn't stable. Not a lot of signs of that slowing down either. We're also seeing a ton of companies really either pull out of the market. There's several that we've gotten announcements that they're no longer selling in certain states, or we're seeing the market basically not come out with any new paper, right? So there is a new Medicare supplement. I know of one Medicare supplement that's really launching this year in a lot of states and a lot of areas. One company is coming out with new paper in 2025. I don't know of anybody else. I'm not even knowing a lot of companies we've seen in the past, like they would sunset a book of business. I'm looking at, your Cignas, your Mutual of Omahas. They would sunset a book of business and resubmit a new book of business. No more new sales on that one, but here's a new company under the same parent. We're not seeing that anymore either. Medicare supplement companies who are choosing to stay in the industry are kind of just batting down the hatches. They're not trying to do new things, and they are trying to just survive what we're seeing as like a really disruptive, tumultuous industry right now. Now, don't confuse this. Medicare supplements are not dead. Medicare supplements are not dying. They're not going anywhere. We're just going to have to adjust to how we talk about Medicare supplements. And that's why this webinar is called A Case for Medicare Supplements. Jay says, thank you for this training. I love Medicare supplements. I will tell you what, guys, I am your perfect Medicare supplement client. We'll talk about why I am the perfect supplement client. My mom's turning 65 in October. I'm putting her on a Med Sup. All right. We'll talk about that here in a second. So why are we seeing the crazy premium increase, the lack of new plans being available, plans leaving the market? Here's just, a study. We've talked about this for a long time, but just reminding those of why we're seeing this industry be so disruptive. Number one is out of control loss ratios. At the end of the day, that's what this all comes down to, is that loss ratios carriers would like to see be in the 70%, 80%. We're seeing loss ratios be over 100%, which means that Medicare supplement companies are not only not making much of a profit, they are losing money on every single Medicare supplement plan that they write, especially in certain states. So why are these out of control loss ratios happening? Increase of outpatient procedures, right? So medical advances seem like a really positive thing until you realize that a lot of medical advances are made for the sake of finances, not for the sake of health. Let's look at one of the biggest reasons and safety, or excuse me, not safety, but health advances are outpatient procedures. Your hip joint replacements, shoulder replacement, knee replacements. Back in until 2017, those were considered inpatient procedures, which meant it was kind of covered under Medicare Part A, right? Medicare Part A, that was obviously affecting Medicare, costing Medicare a ton of money because the deductible, the way that it worked, it was actually less out-of-pocket expenses for Medicare supplements and for the consumers whenever the expense was covered under Medicare Part A. Advances in technology, advances in healthcare meant that those procedures can now be considered outpatient, which then meant it was under Medicare Part B. So that hit your Medicare supplement plans hard, and it hit the cost of your clients very hard. So increase in medical technology means increasing of prices. Lack of historical increases. Okay, guys, so we know inflation. We're familiar with that. It's 2025. We know what inflation looks like. But when we saw what a Medicare supplement plan G looked like back in 2013, we did not really see an increase of premium for a turning 65 plan G across like a 10-year, going on like 12-year process. A plan G back then is about the same as what a plan G costed now. And when I talked about that, it's that standardization of plans. Medicare supplement plans understood that they couldn't offer different benefits. They could offer different underwriting classes and they could offer different services. But at the end of the day, what people searched, thanks to quote engines, thanks to the rise of the internet, was premium. So it was a race to the bottom. Who could have the cheapest premiums? And that really hurt the ability for Medicare supplement plans to keep up with inflation, because it was just a race to the bottom. So lack of historic rate increases really led to these out-of-control loss ratios. Healthier beneficiaries choosing Medicare Advantage plans. That's a huge one that we don't talk about a whole lot. A lot of individuals are used to Medicare Advantage plans. Those plans are getting more and more and more popular. Even with the disruption in the market, we still saw Medicare Advantage plans grow in 2025, not as much as we're used to, but still saw the market share of Medicare Advantage plans grow. What we're seeing is that a lot of people who are healthy, want to invest in their health, don't go to the doctor very often, are going the Medicare Advantage route due to the extra benefits and the cost savings of having a lack of premium, or at least the perceived cost savings of the lack of premiums compared to Medicare supplements. Those who are high utilizations, those who are unhealthy, tend to like to go toward the risk aversion option because they're much more likely to use the actual healthcare benefits. And that's why a lot of your unhealthy clients go towards the Medicare supplement route. So again, if the book of business is unhealthy, then the premiums are going to have to follow suit. That's the way the actuaries have to price this. Speaking of actuaries, guys, let's talk about the craziest thing. And I have on here Missouri, but what I really mean are state guarantee issue situations. I put Missouri on. Missouri is one of the longest states on record that has some sort of guarantee issue situation when it comes to Medicare supplements. But we're now up to we're up to 13 to 15 states now have an active guarantee issue window outside of just somebody's within 6 months of their Medicare supplement, of their Medicare Part B. So they're going to go in and be in open enrollment. I'm talking about true guarantee issue states. So 2 ways that guarantee issue has really blown up in the past 2 years. Number one, I'm going to do this because I like to talk and have a limp. I just want to chat. So number one, states coming out with guarantee issue rules. I'm talking anniversary rules, birthday rules. More and more states are basically hacking up the market and making it to where more people are able to get on a Medicare supplements without qualifying medically. The other side of that is in 2025 AEP, we saw millions of Americans lose their Medicare Advantage coverage overnight due to service area reductions, with everything going on crazy in the Medicare Advantage world, which if you want more information on that, I'm actually doing a webinar here at 3 o'clock with Integrity to talk about the market disruptions. Go to smsteam.net. You can register for that. They give you a little bit of a promotion, selfless promotion on that. But there is an idea of during that time during AEP, so many plans left the market, which opens up a guarantee issue opportunity for those who are interested in Medicare supplement. And a lot of those people were scared by what was going on with Medicare Advantage plans and wanted to get back into a Medicare supplement. When somebody goes through and doesn't answer health questions, 2 things happen. Number one, a lot of sick people, a lot of unhealthy people, a lot of high utilization people get on that plan. That means that Medicare supplement company makes a lot less money because they're using more benefits than what they're paying premium. Easy enough. The other thing that happens is that actuaries do not have a formula to calculate or to build expectations, I think is the right way to say it. They don't have a crystal ball, not formularies, actuaries, all these Aries. Actuaries don't have a crystal ball to be able to accurately predict what premium is going to be needed to account for the loss ratios because they don't know the health of the clients because you're not allowed to ask health questions. So actuaries have to go in and essentially, it's more mathematic than this, more scientific, but throw a dart to see how do we be competitive, but how do we not lose our butts on this book of business that we don't know what's going to happen. But we can guess a lot of it's going to be unhealthy because if it wasn't unhealthy, then they probably would have already been on the Medicare supplement and would have gone through underwriting to do so. So there's a lot of reasons why we're seeing massive rate increases on Medicare supplement plans. And quite frankly, not a lot of end in sight. We're hoping, we're going to get back to a time, not hoping, we're pretty confident. We're going to get back to a time where single digit Medicare supplement rate increases are certainly in the future for us, but I don't have a timeline on when that's going to happen. Ultimately, it comes down to when will the market finalize its corrections? Will the market catch up to where premiums need to be? But the problem is that for every rate increase that a Medicare supplement plan will have, the cost of Part B medications is going to go up. More people are going to get diagnosed with late stages of cancer. More baby boomers are turning and going and utilizing the benefits. The T65er guys, okay, I'm now officially on a rant. I'm 15 minutes in and I'm ranting. The T65ers are the people who pay the lowest premium, and they are the ones who are in the highest utilization because many people, thanks to what the ACA has done to group health insurance has taken major step backs in being able to offer coverage and being able to offer holistic coverage. So many people are delaying major services until they turn 65 to get on fabulous Medicare. So the people paying the lowest premiums are actually the highest utilization. So the math isn't mathing. We got to wait until the market can correct itself till we start seeing those single-digit rate increases. I do think it's in the future, but I think we're a couple years out from being able to really count on the stability of Medicare supplements. Yeah, Jay said the Virginia birthday rule will be a game changer this year. It has been in every state. If you look at Missouri's, again, we're one of the longest running states that's had an anniversary rule or a birthday rule. If you look at the premiums of Missouri and compare it to the premiums of our next door neighbor, Kansas, Medicare supplements in Missouri are way, way more expensive than the Kansas side because the actuaries have to adjust the premiums based on the market. So, double-edged sword, those guarantee issue rules in these states. Let's talk about a little bit of adapting, right? I painted this picture of what Medicare supplements are doing, how they're reacting, why is this happening, why is only so helpful, right? Because a lot of people don't care why are Medicare Supplements doing this? They care, what do you want me to do about that? So ultimately, how do we adapt our sales presentation is how are we presenting Medicare Supplements? It used to be Medicare Supplements, you were just literally, what was the cheapest plan? Let me run you a quote. I'll change you on your anniversary or on your birthday rule. Whatever, a plan F is a plan F is a plan F. We'll just write you the cheapest plan. That can't be the case anymore. Medicare Supplements have become truly more of what I call a luxury item. It is not going to be designed for everybody because not everybody can afford those premiums. I will ask you though, double-edged sword. If you can't afford a Medicare Supplement premium, which is a legitimate concern, I'm not shaming or not downplaying that at all. But if you are going to write a Medicare Advantage plan, most individuals cannot afford a $0 premium. And because what I mean by that is the lower the premium, usually, especially going into 2026 and the market disruptions going on the EMA side, I'm going to be talking about that in 45 minutes. But usually the lower the premium, the higher the risk. If you have a client that's unable to afford a Medicare supplement, you need to make sure they have a plan in place to afford if they get diagnosed with cancer, to afford if they have to go to the hospital. How are they going to handle that max out of pocket? Again, so I talk about cost. Most individuals cannot afford a Medicare or a zero premium Medicare Advantage plan. But let's talk about why I think Medicare supplements are this luxury item. The biggest thing you have to keep in mind is when you are presenting Medicare supplement plans, I believe it's on this slide. Here we go. When you're talking about, I'll get there. How do we adapt to Medicare supplements? One, how are we presenting? Understand it's a setting the expectation. I'm going to talk about that more in a second. But broadening our portfolio and our offerings, guys. If you look at a Medicare Supplement Plan N versus a Medicare Supplement Plan G, the rate increases that are happening to Plan G are those 40% increases, are those massive increases. Plan N is still getting hit, but not nearly at the scale that we're seeing Plan F get hit. Plan N is a relatively very safe bet. And what's very interesting is a lot of people, when I ask why they don't represent Plan N, it's because of the fear of the risks, the fear of the unknown. They say, we know Plan N doesn't cover excess charges, which 97% of providers out there do accept assignment. That is not the same thing as accepting a Medicare. It means, do they accept Medicare assignment? The biggest areas where you see that will come into play is going to be durable medical equipment sales locations, durable medical equipment, and Mayo. Those are about but 97% of all providers do accept Medicare assignment. And if they don't accept Medicare assignment, Plan N only leaves you susceptible to the 15% in excess charges. On average, guys, I think what we saw, it was about like $30 is what Mutual of Omaha said that it doesn't happen very often, but whenever they pay the part Plan G claims, and so they see the excess charges, they see those, they say it ends up being about $30 on average for the majority of people if they ever come across it. So not a huge risk on Medicare Supplement Plan N. I've been hearing a lot of conversations lately about high deductible Plan Gs, which I'm really excited about. Back whenever Medicare Supplement Plan Fs were huge, like they were the Cadillac plan. The first thing I ever talked about was why Plan F was the right plan to be writing, right? How many times can you say right? Was the right plan to be writing, right? Plan Fs were such a big deal. Nobody ever wrote high deductible Plan Fs. There was one company, United American, I think they still offer it, but there was one company back in the day that we really saw any traction with high deductible Plan Fs, but not a whole lot of opportunities or people writing it. However, I'm hearing more and seeing more high deductible Plan G being written right now, and it's huge. And I think that's incredible. It's almost just like this disruption is forcing people to adapt and bring in more offerings that we wouldn't have considered before. And so a lot of people are writing this high deductible Plan G option, adding a adding a hospital indemnity plan to that with a cancer rider, which is incredibly exciting. And a lot of people are going that way. And I'm seeing a lot more traction. And it's a lot of people who like the idea of low premium, low, like kind of pay as you go that you get with the Medicare Advantage plans. But they're scared of the lack of providers that are in network of Medicare Advantage plans, especially your clients who love their $0 PPO plan. Thanks to the disruptions I'm going to be talking about here in 20 minutes, we're going to see fewer and fewer $0 PPOs. We're going to see fewer and fewer PPO plans. So those individuals who like the low costs of their Medicare Advantage plans, but are terrified with being in an HMO style network, which may be what they have available, that high deductible plan G is giving people a lot of excitement and a lot of reason to chat. So hopefully that makes sense. We got to change up how we are doing, how we are seeing the market, how we're talking about this. So how are we presenting these Medicare supplements? Like I said, we're focusing on the luxury component of these Medicare supplements. Like I said, I am somebody, I'll ask you this. If you have a client that they go to Menards, they have all the best intentions that they're going to get, as Menards, as everybody here, I'm from Missouri. I know Menards is like more of a Midwest thing. I'm looking at Alex, one of my producers here. I know Menards is more of like a Midwest, think of it like Ace Hardware, but with more lights. But they always run this 11% rebate, and it gets people in. I don't do this. I never turn in the 11% rebate because I'm not a person that's going to chase the deal, right? I want the convenience. I want the lack of risk. I just know what I want, and I'm not going to work hard for the rebate. That's my Medicare supplement people. They are risk aversion. They want to use the Medicare benefits for the actual healthcare benefits, right? They are somebody who wants to travel, that doesn't want to have those concerns. They are somebody who is willing to pay upfront. I say like budget insurance. They're willing to pay upfront to not have to pay later, and they like that security and knowing that they're not going to have to pay later. Convenient, no networks, fewer restrictions. My number one recommendation when it comes to presenting Medicare supplements is to make sure people have the right expectations, because the expectations have changed. Not in the quality of care, not in the type of coverage you're going to be getting, but in those rate increases. I have a lot of people that if they're expecting, a once a year 10%, $10 rate increase, which a lot of people have come to know and appreciate with Medicare supplements, setting the expectation that, hey, you are going to receive an annual rate increase. And if you're in a attained age state, you might get 2 rate increases. You might get a rate increase at your next birthday, and you'll get a rate increase whenever the book of business receives a rate increase. When you feel uncomfortable or that rate increase starts getting you questioning the value of your Medicare supplement, we can talk options. We can try to underwrite you into a new plan, or we can try to get you on a Medicare Advantage plan. And that's something that could absolutely be done. We've kind of talked about this. My biggest recommendation is please consider a Home Depot with groceries. Thank you, Amanda. Please consider incorporating underwriting, especially we talked to our Missouri agents, and there's a ton of Missouri agents out there that, because we have the Missouri anniversary rule and because open enrollment, and getting Medicare Part B, a lot of agents out there have very limited understanding or very limited, what's it called whenever you've done something, limited experience with underwriting Medicare supplements because you haven't had to in the past. And I want to be clear, you are not allowed to, according to the Department of Insurance, it is against the laws, rules, regulations to ask somebody underwriting health questions if they do not need to be underwritten. So if somebody, for example, you're in California, right? California has a birthday rule. Let's say you're in California, they're within 30 days of their birthday, they're on a Plan G, and they just want to go to a new Plan G with another company. If they're going to abide by the guarantee issue rules, which in California is like to like or like to lesser plan. So if they're on a Plan G, they can go to G or any other plan other than F without underwriting within 30 days. You are not allowed to ask the medical underwriting questions. So then you're going to say, but Olivia, you just told me that I needed to really try to strive to underwrite my clients. Yes, you do. What we highly recommend doing is actually meeting with your clients before they enter in their guarantee issue timeframe. So in Missouri, it's 30 days before and after their policy anniversary, and other dates is their birthday. Try to get them underwritten into a new Medicare supplement plan. If they do not pass medical underwriting, no problem. Once they enter in the anniversary time or their GI period, go ahead and resubmit the policy with the GI, with no underwriting questions. Reason we want to do that, number one, it helps our actuaries. It keeps Medicare supplement business on the books longer. It keeps them in business longer. Less rate increases means less work for you down the line. And number two, you get paid a higher commission. A lot of us are working our butts off on Medicare supplements right now, just rewriting because of these crazy rate increases. we're rewriting our current book of business, which means that not only are we not able to go get new clients, we're just trying to retain our current clients, but our commissions get cut dramatically. Most MedSup carriers at this point pay a one-time $25 commission on GI business. So you want to make sure, one, you help the book of business stay because we want to lessen those rate increases, and two, you can afford to stay in business because if all you're doing is rewriting and getting less commissions on the same client you already had, you can't make a business doing that. So underwrite them prior to their guarantee issue period. They will stay on the books longer. You will get paid a higher commission for that, and the client is still receiving the exact plan that they need to be on. No harms, no foul. Huge opportunity for that. I would also, again, encourage individuals, especially if they are guarantee issue. Like, for example, if you're somebody who is on an SAR, there's going to be plenty more SARs in 2026, guys. We're going to continue to see this trend of Medicare Advantage companies completely dropping certain plans that aren't going to be crosswalked. You're going to have people who come January 1st are not going to have insurance coverage that are guaranteed to Medicare Supplement. Have them look considerably at a Medicare Supplement plan in. Not only is that plan a cheaper plan, a more stable plan, but it does require underwriting. So if they can't get through underwriting on that Medicare Supplement plan in, which is turning out to be a better option for a lot of individuals out there, then go ahead and get them G on that Medicare Supplement plan G. No harm, no foul. You get to stay in business. The Medicare Supplement companies get to stay in business and have a much more stable book of business. And we all get to continue writing one of my favorite products, which is the Medicare Supplements. So is the Medicare Supplement industry crazy right now? 100%. The entire industry is crazy right now. Is it dying? No, it is not dying. Is it going to go away? I really don't think it's going to go away. I really think that we are just waiting it out until the plan tends to, what's the word I'm looking for? Until the market is self-correcting based on all the things we talked about in the beginning. Crazy loss ratios, uncontrollable loss ratios right now, an unstable market with guarantee issue. Medicare Supplements, like I said, my mom will be 65 October 10th. I am putting her on a Medicare Supplement in October. She's in a rural area. She can afford the premiums, and my mom is not one. My mom can bench press Buicks. She is one of the most athletic ladies I know. This girl, she hits pickleball, and she makes small children cry. She's terrifying. She's healthy as a horse. She's going on a Medicare Supplement because I know that if she needs to use her benefits, I'm excited that she's going to have them. Less disruption, no hassle. I will feel comfortable with her on that plan. I love a good Medicare Advantage plan, but I still see a huge market for Medicare Supplements. So I'm going to go through. That's the end of my spiel. I do, again, here in about 30 minutes, we'll be coming back on with my friends over at Integrity, Ted Sims, as well as Chris Holmes from Integrity, Nyslash and Fleming. And we will be doing a joint webinar talking about 2025 market disruptions, going into 2026 AEP. We'll talk a little bit about Medicare Supplements on there, but we'll dive in deeper about what's going on with Medicare Advantage, what are carriers doing to prepare, why are we expecting to see as much disruption in 2026 as we did in 2025 AEP. So join me for that. Let's see. Some questions I see here. They will know what the MOOP is out of reach. They will need an indemnity plan with a MedSup or MAPD. Very true, Jay. Actually, it was interesting. I was working with somebody who was talking to somebody on a Medicare Supplement high deductible plan G, and they said they've never met their deductible. They're healthy enough. They were just, the reason they went on that one was because they just were afraid of networks. Because again, guys, PPOs kind of probably going to be a thing in the past. Not PPOs in general, but at least premium-free PPOs. I think we're going to see a huge cut in availability of those. High deductible plan G, guys, is looking better and better. Sherry says, if you think about where employer benefit deductibles are today, those folks who are turning 65 now coming off of employer coverage should really be interested in high deductible plan G. 100%, Sherry. That's exactly what I'm saying. It's whenever I first started on here, nobody wrote high deductible plans. Nobody did it. I wouldn't have back then. They didn't make sense to me with the premiums and this. But when I look at a high deductible plan G, I'm hearing about it so much more. People are talking about it so much more. It's certainly something that's taken off a ton. Alex, I don't think there's any more chats, but I just want to confirm. Save big money at Menards. I don't think that's the jingle at all. I think I butchered that. I don't see any more text messages or any more messages. Guys, thank you. If you do have any more questions, this is us. You can give us a call, 1-800-689-2800, or visit us on smsteam.net. We do have a live chat feature there. Feel free to chat up one of the chatty chummers. That is our agent resources and key accounts team that man that. You do not get a robot. You get a real live human being on the other end of that, Monday through Friday, 9 a.m. to 4 p.m. Central Standard Time. Join us on YouTube. Like, you know what our YouTube is. You're on it. This is us. You're on our YouTube. Check out our videos. We do weekly postings. And also make sure you join us every Tuesday at 10 a.m. Central Standard Time for Medicare Cafe. And I appreciate. Thank you guys so much for hanging out with us. We will continue to be beating the drum of AEP prep, of how do we make sure that we continue to supply the right products, continue to bring in the right companies. And diversification, guys, is going to be more important than ever. Make sure that you represent represent products that your livelihood and your commissions aren't, let me say it like this, they aren't governed by the CMS of how much money you can make on products. We'll always have a space for Medicare Advantage plans. I firmly believe that. But diversification of your portfolio is more important than ever before. So if nothing else, my friend,